some of the items that you will need are alcohol prep pads, lidocaine ointment, sodium chloride fluids, which will be provided by your veterinarian, the IV line, and a needle, also decided by your veterinarian. Okay, so you will need to set up the fluids, and you'll get all of your items out. The fluids have a little cap on them. Just go ahead and pull that off. And make sure not to touch any of the ends. Go ahead and remove the cap and insert your IV line. At this point you can ratchet down and close off the valve that lets the fluids out and fill your little reservoir a little wise. To attach the needle, just go ahead and break the seal here, making sure not to touch the ends, and remove the cap there and twist on. You'll need to bleed the line, if it is not already done for you, by opening up the ratchet here, and the fluids will go ahead and fill the line. When it gets to the end of the line, go ahead and close the ratchet end again. Now you're ready to give your sub-Q fluids. So we have applied the topical lidocaine to the skin, and we're just waiting for that to take effect. In the meantime, you'll need to hang your fluids up above the patient, and you can use that if you have a hook, or in a home environment you can use a coat hanger and hang it on the edge of a door, and then you can just hook the fluids like so that they're hanging. Then we're going to break. Scrappy will be getting some sub-Q fluids today, and we're going to show how to place a muzzle in the event that you need one. These can be purchased at your local pet store. So the muzzle has a short side and a long side. You will place the short on the top of the pet's nose, and then under the long underneath, reaching underneath the ears and clipping behind the ears. Then you can tighten by pulling this strap if need be. Okay, so we're going to go ahead and wipe the skin again with our alcohol prep pad, and we're going to tent the skin. So you just pinch up and then make a little tent, and you can push with your finger there to make sure that you have adequate space to insert the needle. You'll insert it at about a 30-degree angle straight into the skin. This is very important that you have a good restrainer that has control of your pet and can make sure that he doesn't turn around or try to move away. And then you can reach up to your bag and give it a little squeeze to make sure that it is flowing properly, to give the adequate amount of fluids that your veterinarian has prescribed to you. You can see the graduated marks on the side of the bag that will tell you how much that you are giving. It is normal to have a small amount of fluid leaking out of the injection site. Just go ahead and apply a slight pressure with a paper towel, and this also may be slightly blood tinged, and that is also okay. Okay, now that you're finished giving fluids, go ahead and close the fluid line and reach back down to your pet, pinching the skin lightly above the needle and pulling the needle out. I hope this video has been helpful, and if you have any further questions, go ahead and contact your local veterinarian.